Okay. All right. Happy Tuesday, everyone. Happy Trendy Tuesday with Pandia Health. Thank you all for joining, whether you're here now or at a later date. We always appreciate it. Tonight, I am joined by the lovely Dr. Sophia Yen, our CEO and co-founder. She's also a doctor. Speaking of which, Pandia Health is the only female-led, doctor-led birth control delivery service. So if you're wondering, like, what's something that makes Pandia Health unique from all of these other birth control services, I would say that that's a pretty big one. So yeah, that is to start us out. Tonight, as you can see by the title, we'll be discussing birth control and UTIs or urinary tract infections. If you don't know what that is, don't worry. We'll go over all of it. So without further ado, let's get started. If you have any questions, feel free to leave a comment down below. We'll have someone get back to you as soon as possible. And let's get started. So first question, what is a UTI for the people who may not know, who are lucky enough to have not experienced one? If you could give us a brief explanation, that would be perfect.
Yes. So a UTI stands for urinary tract infection. And the sad thing is the urethra, which is connecting your, oh my gosh, now I'm thinking in Spanish, your bladder to the outside world is really short in women. But in men, it has to go through this long thing. And so the odds of a bacteria crawling through a dude to get up here and cause an infection is much lower than in a woman, where it's just a short little distance here. And then the other thing that is the education is, here is your uterus, here is your vagina, and then this angle, here's your vagina, but here is your urethra, which is where the pee hole is, and it's right above there. And so you can imagine if you're having sexual relations and you've got like lubricant and it's like nice and wet and slippery and you're having a lot of fun time, but then this little hole right above here gets covered. And so then bacteria can grow and then crawl up there. And so that's how you can get a urinary tract infection, is bacteria crawl up this tube into your bladder, which contains the pee. And this is generally sterile. So pee is generally sterile and there should be no bacteria in the pee. It's just when it jumps out this hole and touches the vagina and the walls and stuff, that's where it can get contaminated with bacteria. Or if this part gets blocked up from discharge or lubricant during sex, then bacteria can run up and cause a urinary tract infection.
Not fun.
Oh, so the symptoms are you pee a lot and it's painful when you pee. So those are the symptoms. And then if you get bad urinary tract infection, it goes up into the bladder, into your kidneys, and then you'll get like back pain and you'll get fever. That you've gone too far. Once you've got the fever, you better run to the ER, urgent care. It's no joke.
Yes. And that is why it's super important to go to a doctor if you're noticing any of those symptoms, anything. Just call a doctor. I know now with COVID, you don't necessarily want to go to your clinic, but you can always call them and just tell them your symptoms. A UTI is obvious most of the time. Again, those symptoms are like pretty straightforward, classic. So they can help you for sure. Is the cranberry juice thing real? A lot of cranberry juice, will that help with UTIs? I'm always curious if that's a real thing.
So the key is cranberry juice, but not cranberry cocktail. So the sugar actually increases bacterial growth. But the problem is, who's ever had cranberry juice without cranberry cocktail, right?
It's bitter.
It's really bitter and nasty. And so maybe, cranberry extract might help, but really just drinking a ton of water. So as long as you've got stuff pushing out your urethra, then the bacteria have no time to run up. It's just flushing. So if you have a history of urinary tract infections, my number one advice to you is drink a ton of water. My number two advice to you is, if you have sexual relations, go to the bathroom and pee to flush out stuff. Or even like, I don't believe in bidets or whatever, but just some water and rinse that area just to make sure stuff isn't. But rinse and pee, that would be like extra paranoid. And then number three, you could try some cranberry juice straight up with no sugar, or a no cocktail. Do you know what I mean? Or just maybe cranberry supplements. I haven't looked at the research on that, but not cocktail.
Okay, good to know. Yeah, I've always wondered if that's a thing, but good to know. So next question is, birth control cause a UTI? Can that become worse?
Yeah. So just to repeat your question, because I'm not sure, it broke up on me, and I don't know if it was me or if it was you. Is
That was probably me.
does birth control cause urinary tract infections? And to my knowledge, it does not. It's an association, but not a causation. And the association is people who take birth control have more sex. People who have sex have the lubricant and discharge and stuff going on down there that blocks up your urethra after sex. And so if you pee after sex, I think this problem would go away. But there's nothing in birth control that I know of that increases your risk of urinary tract infection. So I would say your birth control does not cause urinary tract infections. It's simply the sex that you have because you're on birth control. But if you're using birth control not for birth control, like polycystic ovarian syndrome or bad evil periods, or you just don't want to have any periods, or acne with no sex, I doubt those people have more urinary tract infections. It's just you're having sex, you got goop down there, covered up your urethra, and you didn't pee after sex, then urinary tract infection happens.
Okay. We had an FAQ a couple weeks ago. And in your vagina other than water? And the answer no, because right, it can cause a UTI, get bacteria you don't want in there. So yeah, don't put anything in there. Well, be cautious about what is going in there. Yes, but birth control and UTIs not correlated. Good to know. So next question. Does UTI medication, so say you have a UTI and then you get prescribed would it be antibiotics?
Yes.
Okay. Yeah. So if you get prescribed that, can that interact at all with the effectiveness of your birth control?
Yes. So if you have a urinary tract infection, the number one treatment for it is an antibiotic. And what that is if you take a birth control pill, it actually goes through your mouth into your stomach, and there's something called enterohepatic circulation of the hormones. And if you take antibiotics, that kills the bacteria, and so then that might block the enterohepatic circulation of the hormones, and so you'll have a lower level of the hormones in your birth control pills. And that's why we generally say if you're on antibiotics, use a backup method, and then for a week after you finish the antibiotics, use a backup method while your birth control gets back to the level where it's working at. Though the research technically says it only happens if you take griseofulvin, which is an antifungal medication by mouth, or there's another medication I forget, which is a rare tuberculosis medication. And so those are the only two proven antibiotics that have messed up people's birth control. But theoretically, there's this enterohepatic circulation situation that I've read about as well. So better safe than sorry, better safe than pregnant. And so if you're taking antibiotics, use a backup method plus a week after you stopped antibiotics. Yeah. So.
Okay. Yeah. No, that's great. It's scary when things are going on in your body and you don't know what's happening. So yeah, that extra protection is always great. And wearing a condom is good anyway because it protects you from STIs and just getting gross, all of that stuff. So check out our live, by the way, with One Condoms. They talk a lot about just like finding the right fit with contraception, including condoms. So yeah, check that out. Also on our YouTube channel. So
and we have going with them too.
Oh yes, exactly. It's a little bundle that you can order, right? With the birth control and the condoms. They have a little lube pack. It's very cute. So yeah, would highly recommend. So shifting gears just a little bit, just into talking a little bit about birth control. Last question I have is, can you ovulate while you're on birth control? Any form of birth control, the ring, and then the more permanent methods like the implant UTI. What happens with your ovulation?
So let's start from the most effective birth control methods and work our way down, because that's the new paradigm we want everybody to think about. Think about the most effective and why don't you want to use that, and then work your way down. Pandia Health, unfortunately, we are doing the pill, the patch, the ring, which is more on the bottom side. The most effective is the IUD. With the copper IUD, of course, you ovulate because you continue to bleed every single month. And then with the progesterone only methods, you do continue to ovulate if you bleed. And so about 30 to 50% of women on the progesterone only method, IUD with progesterone, lose their period. So most likely those people don't ovulate, but it still is possible that they ovulate. And then those people that are having monthly periods, yeah, you are definitely you're probably ovulating on those progesterone only methods. Same thing goes for the implant. With the shot, after 3 shots, most people lose their periods. And so those people probably are not ovulating, but the 25% that continue to have bleeds are probably ovulating. On the pill, the patch, the ring, the way that works is it has hormones for 3 weeks, and then that last week you can or cannot come off. If you come off, that is an artificial bleed. That is, you bleed because the hormones dropped. Whereas the progesterone only, they're keeping the hormones up for 12 weeks if you're on the shot, 3 years if you're on the implant, or 5 to 7 years if you're on the IUD. So there's no drop in hormones. But with the pill, the patch, the ring, it's the drop in hormones that causes that bleed. So that is not ovulation. But the pill was originally designed at 110 micrograms of estrogen. And now it's at 35 or 30, or for those people who go low, which we don't recommend if you're under the age of 30, but if you're on a low one and you're 30 and above, that's fine. You have a greater risk of what's called escape ovulation, because this 1 week off was designed for 110 micrograms of estrogen. And now we're at 35, which is 1/3 of that original dose. And so if you're on the heavier side, or if you take other medications, or your metabolism's really up, your thyroid or something like that, or you take other meds that rev up your liver, by day 5, 6, or 7 of your off week, you may experience escape ovulation, and you wouldn't know because you're already bleeding. And so, but then you're at risk of pregnancy. And so in general, the newer pills have 24/4, so 24 active pills and 4 placebo, but that costs more, like ridiculously high more sometimes. And so you can just mimic it by taking your normal pills, which have 21 days, and then instead of taking 7 days off, either skip it and just go straight into your next pack, but just make sure your doctor writes so that you have enough. Or after 4 days, I would recommend just start the next pack. So that way you don't have too many days off and risk that escape ovulation.
Yeah, I didn't know that, but that's really scary because, right, you don't necessarily know. And I feel like that's one of the things with birth control that no one tells you. And so that's why I'm glad people are tuning into these lives, because when you go on birth control and you're on that off week, you just think like, okay, I'll just take the whole pack of those because that's typically what you would do. But it's really good to know that if you skip that last week, go right into your next pack. And that's really great. Another thing I was thinking of, because we just released a blog about this, is what can you do if you miss a pill, or if you miss 2 days of a pill, or God forbid, 3 days of the what is kind of the best course of action? Because it happens, we're all human. So what would you recommend for that?
And if you're going to be on it for 20, 30 years, the odds of you missing a pill, it's going to happen. And that is my, one negative on the pill is you have 365 days to make a mistake. Whereas the patch, you only have 52 days because there's 52 weeks. And with the ring, you only have, 12 to 13 months in a year that you can, it's 4-week periods that you can mess up. So if you miss one pill, you want to take it as soon as you remember it. So I always take my pill at night. If I wake up in the morning and I didn't take it, I was like, oh, crap, fine. But just know if you take it first thing in the morning on an empty stomach, you might be a little nauseous, or you might not at all. At this point in my life, I've taken it forever. My body's like, whatever. And so it doesn't get nauseous. But if you're a nauseous kind of person and you're a newbie and you've only been taking the pill recently, then you might want to take some food with it. Taking your pill first thing in the morning on an empty stomach is a setup for nausea. But if you do that now and it doesn't bother you, then you're good to go. If you miss 2 pills and you look down and you're like, oh, I didn't take yesterday and I didn't take the day before, then you want to take 2 pills now and then 2 pills the next day. And then you'll be caught up. If you miss 3 pills, gig is up. Because you've now dropped the hormone level for 3 days, you will most likely bleed, and you could use emergency contraception if you had sexual relations in the past 5 days, or the sperm swimming around, and you might have some escape ovulation. But you will bleed, and you should use a backup method for the next 7 days if you're going to have any relations going forward. But if you had any relations in the past 5 days, you may want to do some emergency contraception, unless you're doing what I do, which is just take pills until I forget to take pills. If you've had 3 weeks of active pills and then you forget 3 pills, then you're fine and you're covered. That we'll just call that your withdrawal bleed week.
Yeah. So the withdrawal bleed, because I know this can get a little bit complicated, that's just the bleed when then it's just from the drop in hormones, right? It's not the same as an ovulation. Okay. Yeah.
Nope.
I know that gets a little confusing. Okay.
Yeah. And if you've taken 3 weeks of active pills in a row and you miss 3 pills, you're like, oh no, I got to do emergency contraception. But that's just like if you had taken 3 weeks in a row and then you took 3 days of the sugar pills. So you're fine. Mm-hmm. But you will have a bleed, and you could restart in 2 days the active pills, or you could let it go a whole week. But I would recommend just don't be off more than 5 days.
Yeah, we don't want that. And something I like to do, I just set an alarm on my phone. So I try to remember it, and then say that if I'm taking it at night and I'm like, oh, I'm going out to dinner or something where I might not have my phone on me, there's that like 5 to 6 hour window where it's okay to take it in that time. So sometimes I'll take it a little bit earlier, a little bit later, but I try to remember. And that way it's good. It is still good to develop that routine of taking it at that same time every day, but there is like a little bit of a window. So it's not like you're going to get pregnant immediately if you don't take it in that time.
If you're in the pill, patch, or ring, and actually specifically a combination pill. So make sure your pill has estrogen and progesterone. If you're a progesterone only pill, most of them are norethindrone. And that one, if you're 3 hours late, you have to take emergency contraception if you had sex in the prior 5 days prior to running 3 hours late. There is a new progesterone only pill called Slind, and it's a very cool progesterone one that I like, but yet I don't like unless you can drink enough water, drospirenone. And that one is more forgiving, the plus or minus kind of 5 hour situation, but that one is crazy expensive. And so in general, we don't recommend progesterone only pills simply because if you're 3 hours late, you have to use emergency contraception and or abstain from sex for the next 5 days, just until it gets back up to the level it needs to be.
Gotcha. Okay. The last thing I can think of, it just reminded me, what is a reason that someone might want to go on the progesterone only pill, or what is a situation in which you would recommend it? Yes. I've never even heard of it before, Pandia. So very interesting.
The joke in medicine before this new, more lenient progesterone only pill is, what do you call a woman on a progesterone only pill? You call her mom or pregnant, because most people are going to be 3 hours late. It's going to happen. If you just fly from here to the East Coast and you mess things up one way or the other, you're going to be late by 3 hours. Or you go out to dinner, or you see a movie and you're like, oh crap, 3 hours. But who would be on a progesterone only pill? Somebody who's breastfeeding and wants to, because the estrogen will stop the milk supply. So that's who we usually put on progesterone only pill. The other is if you have a history of blood clots, sickle cell disease, or just kind of a clotty situation, then progesterone only pill is okay. If you're 35 and a smoker, then we don't do the estrogen because the risk of blood clot is huge to your life. We don't want you to die of a blood clot. There are other forms of birth control you can use. And those would be the main indicators of progesterone only, is blood clots, smoker, and 35, or breastfeeding.
Okay. That's I didn't know that. I feel like the prescription pill, but that makes sense. Circumstances that only would be better. So, couple takeaways from this evening. The first, back to the UTI, some symptoms are a lot and blood in your urine, correct? Or just painful urine, or both.
Painful urination or blood in your urine. You should not have blood in your urine. It's gone too far.
Go to the doctor.
Or if it's your period, right? Then that's just a false positive.
Okay. Yeah. That's a UTI, and no correlation between birth control and UTIs, but correlation between sex and UTIs. So that's why people get that confused. On birth control, don't worry about that. A thing that we went over, there are control methods will have an ovulation on, such as the copper, correct, and what was the other one?
The progesterone only.
And yes, the progesterone only pill. So be careful on those. You have to be on time if you take the progesterone only pill. If you're 3 hours late, you can get pregnant. So very important to be careful on that. With the combination pill, while it's still important to be regular with it, there's a little bit of leeway, which is nice because, humans are imperfect. So again, but developing that routine is really important. So do you have add before we close? It's a little bit shorter. That's okay. This is a quicker topic.
Yeah, no, I just want to give a shout out to Happy and Ashley. They're two of our great patient care advisors. Thank you for tuning in and, upping your education. And thank you for providing great service to our customers. We get 5 out of 5 on Google reviews all the time. Yes. And I see Dr. White Carey's here. I was on her podcast last Thursday. We had a great time. She and I both did residency together at Children's Oakland, and she is a star and such a good community giver. But she's saying your video, it has been freezing a little bit.
Oh, I'm so sorry. It's funny. No I didn't notice. But it's okay. Yeah, I've been trying to reconnect, but it's okay.
Yeah. No, I think that hopefully people can will figure out what you were trying to say. I was able to figure out what you were trying to say, but it would be ideal if we didn't have those choppy things. But everybody, please do check out Dr. Donna White Carey's YouTube show, as well as on Facebook as well. And the summary is that birth control and UTIs don't have anything to do with each other. It's a confounder or an association, because when you use birth control, you have sex, and it's the sex causing the lubricant and goop that covers up your urethra where the pee comes out. So number one, if you have vaginal sex, go pee afterwards so that you can rinse out your urethra so that you don't have bacteria running up the urethra. And then number two is that if you're on antibiotics or a urinary tract infection, that's where the two come together, and that the antibiotics theoretically could kill the bacteria and then prevent enterohepatic recirculation of the birth control hormones so that your hormones aren't enough to prevent pregnancy. And then number three is that you can have escape ovulation if you are off your birth control pill for 5, 6, or 7 days, particularly if you're a higher body mass index person. And that's because the pill was originally 110 micrograms, and now it's 35, 30, or 20. So urinating after sex is key, says Dr. White Carey. Yes, she and I like to shout these kinds of things. So please, yes, after you have sex, don't lay there all exhausted and lovey-dovey, but yes, a little huggy, but run to the bathroom and pee, especially if you have a history of urinary tract infections.
All right, well, that is it. Again, I'm freezing, so I don't know if this is coming out, but okay. Thank you all for coming. Apologies for the technical confused. I can type out the question in the comments, and hopefully that'll clear some things up. But thank you so much, Dr. Yen, for all this helpful information. Don't forget to check us out. Most Tuesdays, we will be here, same time, same place. And again, Pandia Health is the only women-led, doctor-led birth control delivery service. So I would say that's pretty cool. So, check us out. All of our social media handles are at Pandia Health. You can also look on our website for more questions and answers. Other than that, have a great night, and we will hopefully see you next week. Bye.